You know, everywhere we're hearing about robots and AI taking over jobs. This is in the news, but I want to talk to you about why this is not going to happen to nurses and care managers in our lifetime, which is a long period of time. I want to talk about what's happening with the illusion that is in a lot of the AI discussion, and what software and technology must do to prepare us for the growing caseloads and the elderly population. Announcements like this are very misleading and handled with a tremendous amount of confusion. You know, for years we've been promised flying cars and travel to Mars. Where is it? For years I've been waiting for those robots that do all the work in the home, like the Jetsons cartoon. Where is that? But you may have seen a video called Humans Need Not Apply. It has almost 10 million views on YouTube, and people are paying attention to this. The central theme is as follows. Just as horses were made obsolete by automobiles, so humans will be made obsolete by thinking machines. They use the term thinking machines or mechanical minds as machines, that is to say software, that can think and improve itself. Remember that theme, we'll get back to it in a moment. This is something that's in the news pretty regularly. And it's sensationalizing what AI is and what it can do. And it's important to get to the bottom of it. The reality is that an automobile is not a mechanical horse. We understand horse anatomy. If it made financial sense to make a mechanical horse, we could. But mechanical minds is really a problematic term. Neuroscientists know very little about how human brains think. But human brains are very complex. The truth is, we don't understand how the brain of a bee works either. The bee has plenty of brain power. It navigates flight. It does elaborate dances to communicate the location of pollen. It lives in a large, complex social colony. This is a smart insect. Also, there are no laws preventing the dissection of bees or their brains. But nobody is studying this, really. Nobody understands how a bee brain thinks. I find that fascinating. Because until we understand how brains reason and think, you cannot make a mechanical mind. But let's talk about robots in healthcare. If there's a country that needs to deal with a shortage of nurses, it's Japan. So here we see a robot intended to transport patients. Elderly patients. Now, this patient seems neither elderly or particularly confident. This, my friends, is not a mechanical mind. It looks like a forklift dressed as a bear. But let's get serious, though. There's a humanoid robot here, okay? Now, the Japanese manufacturer here, their marketing says, and I quote, "She has been modeled after a human female, able to move her eyes and face while interacting with patients." Okay. Well, nurses and care managers are about much more than how they move their eyes and face, right? We've become delusional here. To go from industrial robots to humanoid robots playing in these roles, we've really become delusional. But don't worry, there's websites like this one where you can type in your title and it tells you the probability of being replaced by a robot. I typed in NCQA presenter, it came back 100%. 100% guaranteed. Forget it. Move on. But why should we spend time worrying about losing jobs in healthcare when the entire human race is at risk? AI is seen as an existential threat to humanity. Perfectly smart people, like Elon Musk, Stephen Hawking, Ray Kurzweil, and others. It's the same theme as humans need not apply. That these mechanical minds learn to improve themselves and progressively take over jobs more and more, as we saw in that video. Swedish philosopher Nick Bostrom, seen here on the right, a few years ago came out with a very popular book on this topic called Superintelligence. Again, the same exact theme. But Bostrom went further in his talks to distill the concept of the singularity, which is this moment where machines become smarter than humans, and the superintelligence, distill it into one single thing that it hinges on. That is software writing itself. So software, the software that's on your laptop and your smartphones, suddenly writing itself, improving itself. There's only one problem, which is this isn't happening anywhere. I've been a computer scientist in the software field for over 3 decades. I'm a leading writer of AI on Medium. Nowhere is software writing itself. It's not a concept that they teach computer scientists. It's not happening. But hold on a second, hold on. It's 2018, and there's got to be robots all over the place that are telling us what's about to happen here with humanoid robots. So this is a recent DARPA competition where robots were competing for prizes, and it's a reminder of how humbling this work is. It's very difficult to build a robot to do anything in our world. These are not mechanical minds. They were trying to open doors, right? But the more revealing video is this one from Audi.
To be here.
How do you like it? How does it feel for you?
To be quite honest, I think it's mega cool.
She's real.
How reliable
She's intelligent. That's what's going through your mind as you see this video.
I know that some people
Yeah, her hairdo needs work, but she's real. She's intelligent. What I want you to pay attention to is the young man in the back of the car, dressed in dark clothing, with a laptop. He is literally puppeting what she is saying. Jim Henson, puppeting what she is saying. He's typing in what's coming through her speaker. Okay? That's what we're looking at here. This is artificial intelligence. That robot was in I didn't think you'd get that one. That robot was in front of the United Nations last week. That really bothered me. So the illusion of AI, even though AI is doing some very important things, is anthropomorphism. We as humans, we have this tendency to believe that inanimate things are alive and intelligent, right? There's movies about this. Inanimate things are alive and intelligent. Photo op. But AI is doing plenty of useful things, and it has a role. Software doing AI has a role in healthcare, clearly. Let's talk about what it is. Well, software has for many decades been doing what management guru Peter Drucker referred to as knowledge work. He coined this expression to separate people working with information from machinists and laborers. This is a useful thing. Most of us here are knowledge workers, and software is performing knowledge work. We've all used a spreadsheet. Spreadsheet is one of the most important inventions in the history of computing. It helps accountants and other people working with tabular data. It's not a mechanical mind. It's working at an abstraction level far lower than an accountant. It's not trying to be an accountant. The same thing with software as expert systems, with business rules and workflows. Again, not a mechanical mind, working at a lower abstraction level, but absolutely crucial. The neural networks and machine learning algorithms that are all in the news are part of the software knowledge worker realm. They're taking training data applied to very narrow tasks, very useful tasks like recognizing and classifying images and voices, without understanding either. That talking speaker, Alexa, doesn't understand language. She's just matching patterns so you can order more detergent on Amazon. I could not resist but use one more horse analogy in order to drive this point home. That's right. So in the early 20th century in Germany, there was a horse, this is a true story, named Clever Hans. He became famous at the time for being able to do relatively simple math problems. He would tap his hoof the correct number of times. People were impressed by this. Believe it or not, in 1907, they assembled a scientific panel to study this phenomenon. I bet there were people on stage just like me saying, horses can't think. So the scientists discovered that the horse was picking up very subtle cues from the audience, that when it had tapped the right number of times, it picked up on those cues and it stopped. That's right. This is how software AI works. It takes training data and enormous amounts of it, and when it sees those subtle cues, it performs the narrow tasks that the data is associated with. If you take that training data away, or you apply the AI or the neural network to some other task, it fares no better than Clever Hans. And the other puzzling thing is why this has all been in the news in the past years, when AI has been around for decades. And really what's changed is the amount of data applied to it and the amount of processing power. But folks, you cannot take a machine and make a mechanical mind by adding horsepower. It just doesn't work that way. So just to review very quickly, AI does a lot of things in software. It doesn't understand language. It can tell whether a sentence is more or less like another sentence. That's how a parrot understands language. It doesn't understand people, far too complex, or care, far, far too contextual. We're not talking about understanding unless it's like a parrot or clever Hans. So let's move on. Care management is what we're interested in. How can software extend and augment the work of care managers? We know that this is about care coordination and referrals. We know that it's about assessments and human touch. I work for a company, Seniorlink, that employs hundreds of social workers and nurses as care managers. As a computer scientist, I've studied their work very closely. We've studied the conversation between the care manager and the patient and the family caregiver. And what we found was that the conversation had two modalities. The first is human touch, which I think we all understand. The second is formulaic, meaning made from formulas. Clayton Christensen, almost 10 years ago, spoke eloquently about this. He described how institutional knowledge, decentralized from the hospital to the home, the patient and the family caregiver, caused dramatic decrease in the cost of care. And this is what we're after. Much of what healthcare professionals are doing is indeed formulaic. And the care manager, the social worker or nurse, is moving institutional knowledge to the family caregiver and the patient in the home. And this is what Christensen was referring to. And it's an incredibly important thing for all of us to work on, including software. Now, care management can take on many forms. In the home, very expensive, not very scalable. Telephonic, known to be highly inefficient, but it's how most of it is getting done. Secure messaging, a new medium for care management, which I want to dig into here, because software can play a role there. And some automated forms of care management. This slide is interesting because as you look towards the right, efficiencies increase and costs decrease. You can look at it as I shift to the right on different mediums, case loads can increase. And this is important because caseloads must increase. With the catalyst of the baby boomers and the growing elderly population, we need to be able to support higher caseloads without sacrificing quality. We also need to activate the family caregiver, the huge, caring, unpaid labor force that is in the care team for a lot of the high-risk situations. Secure messaging is not only efficient, it's also extremely convenient. Care team members can respond when they have time, when they get to the message. It's multifaceted. You can attach images, documents, and links, and refer to them at any time. You can't do that with a phone call, right? You can search for them. You can search for reference materials that you may have gotten before. It's also worth noting that the demographic of the family caregiver is much more likely to understand the secure messaging medium. They're using it to talk to their friends on Facebook Messenger, so they already know how to use it. But in the healthcare setting, it's secure, and it's a different platform. Now, here's where one of the places where software can play a critical role in increasing the efficiencies of care management. Because once part of the care collaboration conversation is in secure messaging, software can then either issue a response to certain questions or suggest a response. Here we see a pretty straightforward question about sending info on metformin. So software and AI software is very good at generating probabilities and doing math. It can know that this is a very high probability response and actually respond. If the question had been, can you talk about the change in dosage for metformin, that would be a low probability response, and the software would suggest to the care manager what might be a worthwhile response. She can then edit that, accept it, reject it, but we're creating a machine learning loop there. So increasing care management efficiencies without sacrificing quality. This is just one example. When we blend machine and human experts, that's what we're doing. We're increasing care management efficiencies without sacrificing quality. allowing healthcare professionals to focus on more nuanced, contextual, and complex aspects of care collaboration. This isn't about building mechanical minds. This is about building mechanical assessment tools and informational lookups. In doing so, elevating the work, the day-to-day work of care managers. We have a job to do, ladies and gentlemen, with the growing elderly population. It's not science fiction, it's real. It's not futuristic, it's now. Let's work together with software to get it done. Thank you.